There's no shortage of research on the new coronavirus, and keeping up with it is a challenging task.
Fortunately, our Dr. Frank McGeorge spends hours every day keeping current. And today he's here with 3 new papers adding to our coronavirus understanding, starting with one on the loss of taste and smell, Doc.
Yeah, Jason and Kim, anosmia, the loss of smell, and dysgeusia, a change in taste, are 2 of the most unusual symptoms of COVID-19. Now, many people who have lost their smell or taste have emailed me asking if it will return. Well, now a new study has an answer.
Research published in the Journal of the American Medical Association looked at 113 patients with anosmia or dysgeusia and followed them to see how long it generally lasts. They found after 1 month, 49% of patients had regained their sense of taste or smell. Another 41% had overall improvement, but 11% reported the symptoms were not improved or worse. The authors noted that persistence of the symptom was not an indication of ongoing infection. Now, strokes can be associated with certain viral illnesses, including influenza, but a new study finds the risk associated with COVID-19 is much more significant. Patients admitted with COVID-19 were compared to patients with influenza in 2 New York hospitals. Researchers found 1.6% of COVID patients experienced a stroke, compared to only 0.2% of the influenza patients. Adjusting for age, sex, and race, the likelihood of COVID patients developing a stroke was 7.6 times higher. The researchers indicated that these findings need further investigation, especially because they are consistent with the previously described increase in clotting risk from COVID-19.
Now, finally, I want to mention a CDC publication that looked at COVID-19 surveillance efforts in 26 Detroit skilled nursing facilities. Overall, they found 44% of those tested were positive for the virus, with 24% of the infected people dying. But more importantly, the large-scale screening in Detroit identified a high percentage of asymptomatic people, which did allow health officials to group infected people more precisely and target infection prevention and control strategies, which ultimately really created safer living conditions for all of the residents. Back to you.
Which is very important, obviously. All right, Doc, thanks.